guys. Well, update on my doctor's appointment yesterday. Did not go so well. They basically won't do anything for me for my hernia, so I'm stuck just keeping it until it's an emergency, and then they have to slice me the freaking hell open and fix it then. So that's just great. So great. And he said even if I went down to 250, he still wouldn't fix it. So that's fucking fantastic. Thank you. Thank you so much. That's just fucking awesome. But he did offer to give me the gastric bypass, even though the doctor that gave me the sleeve wouldn't touch me with anything like that after finding out that I got diagnosed with multiple sclerosis after my surgery. So that doesn't really help me because I did not want to have the gastric bypass. I did not want my intestines messed with. Yes, I thought about it for about 2 seconds, and now I'm like, why the fuck am I going to do that? I mean, look at how well the sleeve did me. I'm an emotional eater. I'm a yo-yo fucking dieter. It is what it is. The fucking gastric bypass is going to be just as fucking well as the sleeve. I'm sure there are many out there that have gained their weight back. And I have gone back down, I've gone back up, I've gone back down, and I have gone back down to the lowest point that I was at several times. My lowest point was 280. So, yeah, that's ridiculous. I don't know. I don't know. So, I went to talk, I had a second appointment, and I went to talk to, it wasn't a dietitian, it was like just a regular doctor, but they deal with, like weight loss pills that are apparently, prescription form cocaine. And I was like, what? Yeah, so I don't know about that either. That kind of scares the crap out of me. But they're going to have to get permission from my multiple sclerosis doctor before I could even attempt to try something like that. Because who knows how it'll work with my, if it'll affect my MS or what, So that's super fun. And also with other meds that I'm on, there could be potential badness happening. I'm not on any MS meds. I refuse to take any MS meds because of past experiences I've had. And I have had my neurologist be up in my face trying to force feed me MS meds, and I will not take it. I don't care what anybody tells me. And no, it's not because of blogs I've read, like she got in my face and said, oh, well, don't go and listen to all those blogs and read all those blogs and blah, 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 blah. No, ma'am. It's from my personal experience taking the MS med that was supposed to be the least worst side effects or what the frick ever. So, no, it's not from reading anybody else's blogs. I try to stay away from that shit, and I try to stay as far away from other people's MS symptoms as I can because I don't want to terrify myself. So, screw that shit. No, that is not where I get my information. I get it from the websites themselves directly to those meds, where it lists right there all the potential side effects and symptoms that I could possibly have. And I'm like, no, thank you. No. No. I would rather just live with the side effects and symptoms that I have day to day with my MS than try to take these meds that they don't even really do anything. At least not to where it's going to take it away. It's not going to cure it. It might lessen your relapses over time, but that's not even necessarily going to happen either. So, fuck it. Fuck it. When I was on, I can't think of the name of it right now, but it was an injection. I had horrible side effects. I could not function normally like a human being. I could do nothing. And she got in my face and was like, oh, well, the flu-like symptoms that you experience. No, ma'am. It had nothing to do with stupid flu-like symptoms. That's a walk in the park compared to what I had to deal with on that damn medicine. No. Don't get in my face and tell me flu-like symptoms this. And flu-like symptoms, by the way, can be deathly and put you in the freaking hospital and put you bedridden too. So even if it was just flu-like symptoms, that's fucking nuts. No, fucking no. I will not do it. I'm just, well, actually, part of the reason that other sleeve doctor was willing to give me the gastric bypass is because of my unwillingness to take the other MS meds. My dog is just like so bugging me right now. I'm like furious with everything right now, but this isn't even the cherry on top of the pile of shit. Today we woke up and, well, my husband just randomly, I guess, decided to check on my car or turn on my car or whatever. I don't know why. I don't remember. But guess what? Freaking rats ate the goddamn wiring again. Again. They did it last month and it cost $1,000 that we don't fucking have. That's in credit card debt. And the credit card for the car place is maxed out. So we went through the insurance company this time, which we should have last time, but he didn't want to for some stupid reason. I don't know why. But yeah, so we're going through the insurance company this time, and I got a rental that's a little teeny tiny piece of fucking shit. They only cover $20 a day for rental, so we're covering the other $5. Yeah, no, I can't drive this car. It's tiny. It hurts my hernia to drive it. I was barely able to make it home okay. So it's basically going to be in my freaking driveway for emergencies because I don't want to sit here out in the middle of nowhere in the country with no car in case there's a freaking emergency. Because God knows that's when emergencies are going to freaking happen. So yeah, I've just had like a really stressful couple of days. It's like just so freaking ridiculous. But I'm still loving my haircut, so you know, there's that at least. So cute. I'm such a dork. So, if my MS doctor approves me trying these meds, there's one of them that makes carbs, like breads and pastas and stuff, taste like ass. So, that would be the best one for me. Because, again, I like my carbs, I like my pastas, I like my rice, you know, I like that stuff. I like my bread. So, if you can make that stuff taste icky, then that would probably be a good one to try. But even the other one, I mean, I'll try it, you know. I'm pretty sure I've been on one of them before, back before I had my sleeve, because they make you go through different testing and diets and stuff before you can have it. And I'm pretty sure I had shitty side effects. Because I always have shitty side effects. That's my life. I get the shittiest side effects to all the meds. That's another reason why I don't want to go on any MS meds. MS treatments. MS anything. Oh, and I also found out one of my meds that I have been taking, I need to stop taking because I wasn't supposed to be taking it with my sleeve. But because we stopped seeing my sleeve doctor several years ago because he basically treated me like I was a leper because he found out I had MS, I did not know that. And he also said that, oh, well, since you had the sleeve and not the gastric bypass, you can go ahead and take all the meds. Okay, so I thought that I was in the clear and I could take that med. How was I to freaking know? I'm not a freaking doctor. I don't freaking know this. My neurologist knew I had the sleeve surgery. I've had pretty sure I was still seeing him back when I first started taking that med. So everybody told me it was okay to take it. Now I find out several years later, oh no, you shouldn't be taking that because it can cause an ulcer and mess up your sleeve and cause lots of problems. Oh, yay, fun! So, no more of that medicine for me. And it was like the only little bit of pain relief because I haven't gotten any painkillers or nothing because of the stupid new rules of having to go to like pain management and do all this bullshit. I'm not going to jump over goddamn fucking hoops. I just don't fucking want to. So I deal with my pain. Yes. You know, what else am I supposed to do? I've tried going to a pain management doctor and got treated like utter fucking shit. So, yeah, it's not my thing. I don't want to do it. I don't want to fucking go through it. And it just stresses me out going to doctors, period. I get severe anxiety just sitting in those offices and I want to freaking scream. And I can't deal. And I can't deal with the paperwork and the people and the things and the lights and the... I can't deal with it. I can't. I get sensory overload. I don't know if it's an MS thing. I don't know if it's my mental illnesses. I don't know what, but... So, yeah, there is a lot that I just cannot deal with. I cannot. It's too much. It's overwhelming. It's just... So... I will continue my diet the way that I'm doing it. I might try, you know, what they suggest. They suggested a nutritionist and a psychiatrist or something. I'm seeing a therapist already, so I don't know. But, honestly, I don't know. Like, they suggested that. They had it written down, but then they sent me on my way without telling me what they were going to do about that. If they were supposed to, like, recommend me to somebody, give me something. I don't know. So I'm just going to wait and see if they call me up or maybe call them up in a couple days and see, you know, hey, did my doctor approve me to get on this stuff? And what about the nutritionist and the other person you were supposed to send me to? Like, what's going on with that? So, how are you supposed to cure emotional eating and yo-yo dieting when you're almost 37 years old? Does it ever happen? Seriously. I mean, I would honestly be happy at 280, but apparently that's not good enough for the doctors. It's not good enough for anybody. So, you know, I don't know what that means for me. Oh yeah, and then they suggested I go walk several times a week for 30 minutes. That's not going to happen. I live out in the country. We have like rocks and crap. I'm not going to risk falling with my MS and no. And the weather, no. And the outdoors, no. I mean, I can't. I just can't. I have issues. I have problems. I have anxieties. I cannot just go outside and just walk. And I can't go to freaking Walmart and walk because Walmart is like a fucking nightmare. And oh my God, every time I get in that place, I have a severe anxiety attack because there's too much going on. Too many freaking people. Too many, just everything is too much for me there. And I freak out, and I honestly don't know how I was able to handle the mall yesterday, but my husband was with me, luckily. I can't do Walmart without my husband. Like, even when he's there with me, I still freak out. I've had agoraphobia in the past. I guess, you know, it still flares up at times, obviously. I had it where for 9 years I couldn't leave my house unless it was with my husband. There was a year there where I got better. I was traveling. I was doing fun stuff. And then so much depression and horribleness happened. And now it's a struggle again, and it's hard. And I mean, I get out to my therapist, and I stopped even going and hanging out with my friends or anything. And I've been struggling with depression, and just it's been bad. It's been really bad. And I don't know. I'm getting close to 15 minutes. I don't like to make these too long because my internet is horrible and it takes over an hour just to upload 15 minutes. So I guess I'm going to go ahead and just end it here. You know, I could always make a second video if I have anything else to talk about. But, you know, if you got any hints, tips to help me cope or to diet tricks, I don't know. Like, please, positive comments only. Keep the negative ones to yourself because I can't deal with that right now. It's just been a bad couple of days. But yeah, please check out my other videos, like my videos, subscribe. I'll see you later. Bye.